Hello, it's Dr. Rhonda Johnson. Today's Wednesday, July 19th, 2023. Today I'm discussing hearing screening, hearing loss, and dementia. Well, according to the World Health Organization, hearing loss is growing more prevalent by the day, and they estimate that by 2050, 1 in 10 people will have disabling hearing loss. Now, hearing loss is not inconsequential. A person with hearing loss can experience issues with their physical health, communication challenges. If you can't hear, people may assume that you're a little slow. They may experience emotional challenges, relationship challenges, self-esteem challenges, and work performance challenges. Now, there was a recent article published in the Lancet Journal that looked at the relationship of hearing loss and cognitive decline in at-risk adults. This study utilized the results of a 3-year multi-center randomized controlled trial for adults ages 70 to 84 years with untreated hearing loss. It was called the ACHIEVE study. Now, they had about 1,000 people between the ages of 70 to 84, and they followed them for 3 years, and they found that the group who had untreated hearing loss but were in the control arm that had hearing aid placements, that over their 3-year period, their cognitive decline slowed by 48%. And these people had increased risk factors for dementia, such as diabetes, high blood pressure, and living alone. So what about everybody else? What are the risk factors for hearing loss across the lifespan? Well, folks, age is the strongest predictor of hearing loss, with your greatest risk of hearing loss in the ages of 60 to 69. Now, men are almost twice as likely as women to have hearing loss. Now, other causes include trauma to the ear or to the head, chronic exposure to loud noise, loud sounds such as going to fireworks shows, concerts, being exposed to really loud music, going to these very loud sporting events. There are some medications that can cause toxic reactions to the ears, and some work-related chemicals that are toxic to your ear and hearing. There are nutritional deficiencies. Did you know that vitamin D deficiency and folic acid deficiency can make you at risk for hearing loss? Things like viral infections in particular and other ear conditions in childhood can make you at risk. So when should you get screened? Well, I think practically if you are having trouble hearing, conversations of friends and family, sometimes your loved ones will tell you you need to get your hearing tested. Another time that you should get it if you have experienced chronic ringing or other noises in your ear. That's commonly called tinnitus. Some sources say that almost 90% of people with tinnitus have some degree of hearing loss. Now, what's the evidence for hearing screenings? Well, the United States Preventive Services Task Force says that the evidence is insufficient to recommend screening for hearing loss in older adults. But the American Speech and Language Hearing Association recommends that adults be screened by an audiologist once per decade and every 3 years after the age of 50, or more frequently if you have risk factors associated with hearing loss or a known exposure. So how do you check your hearing? Well, 2 ways. One is a hearing screening test, which is a quick test that you either pass or fail, or a complete hearing evaluation done by an audiologist. And they'll tell you the degree of your hearing loss and what you can do to treat it. So, folks, that's my message today. I know you know how important it is to hear, and do be safe. If you think you need to get a hearing test, look around. Many places offer them for free, and I hope that you will take advantage of the resources to correct your hearing if you have a hearing loss. That's my message today. As always, be safe, folks. Be well and take care.